Hello, everybody. Thanks so much for joining us. And my name is Dr. Bob Gabe, and I'm the Chief Scientific and Medical Officer for the American Diabetes Association. And really appreciate everyone joining, and in particular, my two guests. And we'll be introducing them in a moment. Let me just frame why we're here. We've all seen the heartbreaking images from Ukraine as this devastating situation has been unfolding. It's been nearly 2 months now, and literally every day there's just tragic stories. And I heard one recently where um, when we think about diabetes in the midst of all this, uh, there are parents that are writing in marker on the back of their children, on their backs, to identify their health conditions. And so, because they don't know whether they'll be with them and whether they may lose them. And lots of families are split apart. And so, early on, when this, huge situation developed in Ukraine and the war began, uh, we at the American Diabetes Association began thinking about what can we do. And of course, our lane is around diabetes. And so what can we do for people with diabetes in the midst of all this? And it may not be the first thing that comes to everybody's mind, but once you start thinking about it, as you hear our conversation, there are a lot of issues that need to be considered for these individuals with diabetes that are in the midst of this crisis. Um, so the American Diabetes Association has mobilized our efforts to assist in any way we can. That's been through partnerships with other organizations. A number of years ago, there was a effort by ADA and other organizations to think through disaster relief for people with diabetes, and that, in some ways was born out of the experience with Hurricane Katrina in New Orleans. And that brought together a coalition that now is able to respond to lots of situations. And sadly, they keep happening. And the latest one we're going to talk about is here in Ukraine. And so I'm joined by two fantastic people that will really be able to shed a great deal of light on this subject and have been involved in international health around diabetes for a number of years. So the first is Sylvia Collenbrink, and then I'll have each of them introduce themselves in the moment. So Dr. Collenbrink from Brigham and Women's Hospital, and then Dr. Nuhel Saeed, who is here with us at the American Diabetes Association. So Sylvia, do you want to just briefly introduce yourself to the audience?
Sure, yeah. Thank you so much for having me. As Bob said, I'm Sylvia Kalenbrink. I'm an endocrinologist at Brigham and Women's Hospital, and I'm also the director of the Non-Communicable Diseases in Conflict program at the Harvard Humanitarian Initiative.
Great. And Nuha.
Hi, everyone, and thank you, Bob. Nuhel Saeed. I'm also an endocrinologist in Boston, and I'm the Vice President of Healthcare Improvement at the American Diabetes Association.
Great. So let's dive into this, and I'll start with you, Nuha. So one of the things that people don't necessarily think about are beyond providing the raw materials, insulin, blood glucose monitoring. There's a lot of information that's needed for people with diabetes that are in Ukraine. And so maybe share a little bit about what you've been working on and ADA has in that regard.
Yes, so one of the most commonly requested documents and guidance is what we call switching guides, and specifically insulin switching guides. So basically during times of war, conflict, or any form of natural disasters, people with diabetes may need their current insulin types or formulations switched because we either have limited supplies or limited options. So insulin switching guides is sort of an informal guidelines that provides guidance to healthcare workers on the ground as to how should I safely change somebody's regimen from one, point one to what's available on the ground. As you alluded to, like if insulin is available, it's not going to be exactly what every person with diabetes is on. So this is one of the most important documents that actually, have been requested. And this is what we have been working on, at ADA through the DDRC and the various organizations that we've been interfacing with.
And so for folks that may be less familiar, when you like switching insulin, meaning like what? Yeah, what? Give an example, perhaps.
So say you are on, a certain type of insulin, that is long acting, and a certain type of insulin that is for mealtime, and it's a certain brand, a certain kind, and then
You're used to Glargine or
Novel,
yeah,
whatever trade name you're on, or whatever generic name you're on, and war hits and pharmacies don't have it. So what should you go on? Sometimes it could be something very similar, but sometimes it could be something different, but we fashion it safely so that you can be on it until you're moved to safety and your usual kinds of insulin are available.
So something like switching to NPH, which some people with diabetes may remember using many years ago, but don't use so much, and regular insulin, and how to do that safely.
That is correct. So this is the document that, it's the main document, and from there stems a lot of other documents.
And so these documents are, how do we get them out to people that need it?
So first we had to create one that is, specific for Eastern Europe, because it wasn't just Ukraine, it's Ukraine and the areas around Ukraine that are receiving, the refugees, basically. So, and we had to translate that and change it to the context, working with various people on the ground and ministries of health. And from there, we need to disseminate it. So you need to get it in the hand of people who are caring for people with diabetes on the ground. And this is what we've been working with, along with Sylvia very closely, we've disseminated through a lot of the humanitarian organizations, and also through our various, collaborators and volunteers on social media and elsewhere.
And so you mentioned, collaborators and partners. And so, Sylvia, this is an area that you've been really involved in a number of years in terms of international responses to a variety of calamities and disasters, and the latest being now in Ukraine. Talk a little bit about the importance of these kinds of partnerships and some of the key players, perhaps.
Sure. Yeah. No, I mean, to your point earlier, diabetes may not necessarily be something that you think of first thing when you think of a humanitarian crisis. But with current global statistics, over 500 million people globally having diabetes, and humanitarian crises in general, currently at an all-time high. And, the projections are not going down. If anything, they're going up. Providing diabetes care in these settings is absolutely critical. Continuity of care, continuing life-saving medications. And up until a few years ago, the humanitarian community wasn't really focused on this issue, wasn't being coordinated formally, and it was being relatively neglected. And so a few years back, various organizations started thinking through, how do we provide diabetes care in these very fragile contexts? And a lot of organizations starting to work on similar things, guidelines, epidemiological indicators, things like that. But we don't need every organization doing the same thing. We need to coordinate and have organizations that are very good at something, like the ADA coming up with guidelines. It's your strength, helping with that aspect, and having other organizations work on other things. So working collaboratively across sectors, across organizations, to really improve care as a global community is absolutely critical. So that's what we've been trying to do over the last few years, and especially now with the Ukraine response.
Yeah, and it really is an example of where it takes a village, in
Yeah.
essence, to solve this problem, and there are all sorts of logistics, and you know, Insulin for Life. Not everybody is familiar with this organization, and they've been a key player in all of this that we've been working very closely with. One of you want to talk a little bit about them and what we've been doing with them?
So, I mean, we're partnering with Insulin for Life. I mean, they have a representative on our DDRC, which is, a wonderful representation. They've been invaluable in guiding, even the documents that we create, providing input. And the biggest thing is getting insulin to people on the ground. They have been amazing in not just getting insulin, but also, supplies. They even made it to pump supplies for people who own that privately around Ukraine.
Yeah, really great organization, and the logistics that we often don't think of you may have the materials, but how do you get it to the person that needs it? It literally with bombs flying around, and so really heroic work, and the name Insulin for Life sort of really certainly for people with type 1 diabetes. Yeah, I mean, it's literally that. And although, Sylvia, as you said, we don't think about diabetes as the first thing, if someone, particularly with type 1 diabetes, doesn't have insulin, um, they likely perish within a couple of days, and really critically important. um, Sylvia, maybe a little bit of some of the other organizations that you think have been helpful in all of this, and the kind of coordination that's important.
Yeah, yeah. No, I mean, so in the Ukrainian situation right now, the Ministry of Health in Ukraine has been a key driver of the response. And so they are still on the ground working tirelessly. And most of the response is going through them together with the World Health Organization. So the health cluster at the WHO has been working closely with the Ministry of Health to coordinate. So they've been key organizations, but then of course you have all of the humanitarian organizations like Doctors Without Borders, providing supplies, helping with mental health support, providing education and support in Ukraine, honestly, the healthcare staff on the ground, they're predominantly local providers still that are there. They haven't necessarily left. And so providing support to them. Others that have been very helpful in the response is Direct Relief. They've been working closely with the International Diabetes Federation to provide supplies and insulin. The International Rescue Committee, the United Nations High Commissioner for Refugees, working with the refugee population. So there's many organizations that are all trying to coordinate to help.
Which is certainly heartening that there are lots of folks, and Nuha, you mentioned DDRC, and maybe share a little bit about how that works to coordinate all of these, or many of these organizations.
So, it's co-led by an ADA person, Kelly Mueller, and also, represented from Insulin for Life. To be honest, this is what started our efforts. They reached out to me to convene a writing group, to basically adapt our guidance in disaster response sort of type areas to, this Eastern European war area. So, it remains a very integral part, like in getting people together, interfacing with various organizations. Some Sylvia have mentioned. I mean, we've worked closely with International Diabetes Federation Europe. They've been instrumental, to our efforts and to keep what we create relevant.
Great, and the tools that you've all developed. There's also a translational piece. Need to translate into a variety of different languages.
Yes, so I think we have 8 languages, and all of them are Ukraine and then the countries around that received refugees. It has been very, wonderful. Like, we called out for volunteers, like in the medical world, who have the expertise to do that. And we have been, we've received a lot of volunteers helping us with the various languages. We've had a volunteer who paid out of pocket to do it without telling us, and got it translated. So it's been wonderful. People have been, united, and we continue to produce other derivatives of the guidance that was initially created.
Yeah, one of the things that are what I saw, some nice pictorials that sort of give you a quick, like, oh, okay, I get it, with that idea that a picture's worth 1,000 words.
Yes. So, again, interfacing with various organizations that are agile and can create these documents, it's been wonderful, whether it's IADA or DIFA or, DDRC. What we've heard is, okay, so we created a switching guide, and this was helpful in Ukraine. But when people go to the pharmacy to get their medication, and then they're using the guidance to switch them, our patients were having anxiety issues. Like, why are you giving me a different medication? So we quickly had to create an infographic to basically help people understand what is happening. And then now we're working on first responders papers. We're working on, other things. People with diabetes can go through high glucoses, low glucoses. What do you do? What's red, red flags? So all of that is in production with our writing group.
Excellent. So one observation has been that social media has played an important part in our awareness of what's been happening in Ukraine, and so, any thoughts on how that has helped spread the useful kind of information that you're all working on?
So we got a lot of our volunteers to actually help us adapt, give us feedback, and translate through social media. So there were a lot of professional Facebook groups that are just for healthcare providers. So that started there, and we also disseminated there. And you can tell. There are people from Ukraine, that receive the material, and then through our channels and various other organization channels, basically you mass send it out and make sure that someone sees it. And Sylvia, also could speak to sending them directly to humanitarian organizations.
Yeah, so these switching documents, we have, so the International Alliance for Diabetes Action, or IATA, which Nuha alluded to earlier. It's this alliance of over 50 organizations working to coordinate diabetes care. We were able to send out these documents to all of the humanitarian groups, the various actors to disseminate. And then, of course, social media. There's nothing quite like it, right? In getting the word out to everyone. And especially right now, educational resources for people living with diabetes, how to manage when you're not near a healthcare provider and when you're, essentially left to your own devices for a while. How do you manage? And so that's where we're really hoping that social media will be able to reach them and provide some support. Yeah.
Yeah, sadly, one can picture someone in a bomb shelter somewhere and trying to literally figure out how to manage their diabetes in the midst of everything that's going on. And so the resources that you've created and spread, I'm sure, are incredibly valuable for them. We're moving quickly on time, and so maybe couple of final comments that for each of you to make. Sylvia, if you want to start.
Sure. Yeah. No, I think what we're seeing right now in Ukraine, the challenges in terms of logistics and providing the medications and diagnostic supplies and education to the people that are affected by the crisis, it's something we see in every humanitarian organization. And so that's why we're working as a community to ensure that every humanitarian organization is equipped to provide diabetes care in any crisis globally. And so we're learning a lot from this crisis, and we're hoping that these materials will be helpful in the future in various settings. So.
Right, because for better or worse, as we alluded to earlier, there likely will be others, and other humanitarian crisis, and this one, of course, is not over yet. Um,
Right. Yeah. No, and we're seeing, right now, even we're seeing similar challenges with insulin provision, for example, in Ethiopia. They're not getting insulin to the
yes,
country. And so these we're seeing this in many settings, unfortunately. So yeah.
and there in particular, I know there are political considerations that have made it even more challenging to get supplies to the people that need them.
Exactly. Yeah. Yeah.
Nuha, some final thoughts?
Yeah, so I mean, for this current crisis, I mean, we will continue to put out materials. So, we would love for our audiences to disseminate, because that's the only way we can get it to people who need it. And to Sylvia's point, I mean, our group, will be developing materials that are specific for other parts of the world. And we would love for, people's input, even participation. And again, disseminating the work, would be the biggest task that we're asking of people.
And where can they find these materials?
So on the DDRC website, and we can put that in the chat after this. But DDRC has it. DIFA, which is the Diabetes Education for All platform, has it. These are the two that will house all of these kinds of material.
Great, great. Well, thank you both so much. This has been an enlightening conversation. I'll, in speaking to the audience, I will make two asks. The first you heard from Nuha, and that's really to distribute these materials to people that are going to try to access them any way they can because the desperation that they're in, um, both for people living with diabetes and those that care for them. Because there are an amazing number of courageous healthcare providers that are staying put and doing what they can, and we really recognize that courage that they're demonstrating. So that's ask number one, is help distribute. Ask number two is to think about donating to Insulin for Life. They're really a wonderful organization that have been providing the raw materials right on the spot, and working through the logistical challenges. And they're wonderful people. They do it with the right heart, and we tip our hats to them as well. And then finally, if you're interested in learning more, our scientific sessions, the big diabetes meeting of the year, which is like the Super Bowl of diabetes, will be in New Orleans in June, and encourage professionals to register, or anyone that's interested in attending. And we will have a special session that we're going to dive deeper into this problem of humanitarian aid, specifically around Ukraine, recognize some of the organizations involved. And at that point, we'll have more lessons learned that we hope will help us all react to these kinds of situations around the world. So I want to thank both Sylvia and Nuha for joining us, and for all of you, and really the community for coming together to meet the humanitarian challenges that exist in Ukraine for people with diabetes. Thank you all.
Thank you, Bob.
Thank you.